This podcast is educational content only and does not constitute medical advice. Consult your healthcare provider for medical decisions. Welcome to Off the Charts. I'm Amy Peepermaster, and the show is about what actually matters in health, not trends or the noise. Today, I'm sitting down with Jani Tuomi. Jani is a digital health entrepreneur, early-stage investor, and co-founder of Imaware, one of the first companies to bring lab-grade autoimmune and cardiovascular screening into your home with a finger prick. He also co-authors Austin Bio and Health Report and has helped build companies across ALS diagnostics, neurotechnology, and physician workforce. What I want you to listen for is how he thinks about the difference between health and care, why he channeled Eminem to flip the Theranos narrative, and what he looks for the moment he shakes a founder's hand. There's also a really practical breakdown on how to evaluate at-home tests. Well, thank you so much for your time and being here today. Really appreciate it. And thanks to Red Fridge for hosting us in this really cool, energetic space where founders come together.
100%. Well, no, I love talking with you, and I'm glad to be here with you. And yes, shout out to the fridge, the little fridge here.
Representing.
Yeah, I love that Red Fridge is like, the most serendipitous space in Austin is their claim. So, it's where people come together and cool things happen.
Absolutely. Well, I wanted to reflect back to when we were first connected, which was quite a while ago now. And you were very kind in sharing your story of how your brother was misdiagnosed and discounted for over a year. And every month that passed, his cancer was getting worse and he wasn't getting treatment. And your mom, who was an ER nurse like me, she got fed up. And that was the movement that really led to him being able to get his diagnosis and transfer and care and treatment. So if you were to put your finger on one thing from that experience, what was it that you couldn't leave behind that led to you leaving fintech completely and moving into healthcare 100%?
Yeah, the number one thing that bothered me, and, thanks for sharing this story, is that there was this thing inside him that was producing side effects and data. And it was just being, avoided and not made available. So a blood test that could have been run that would have showed white blood cell changes or bilirubin or things like that, like very common things, was just being missed. And so it was like, okay, there's this data in my brother's body, and why can't we get access to it, right? Because one person refused to test for it. I'm not trying to say anything negative about the physician in this case, but rather that one person held this sort of access, and it should have just been universally available that, yes, blood test should be run here without one person's opinion. Because once the data was out, it became very clear what to do next, right? Mm-hmm. So that stuck with me, and that became kind of the basis for everything I'm up to, which is how do we extract the data from our bodies so that we don't have to live without the knowledge of what's going on inside.
Yeah, love that. And your parents, we're talking about them, are your inspiration, you say. And you also say you're a nice combination of both of them, with your father being the builder and your mom being the ER nurse.
Yeah.
How has their influence impacted how you solve problems?
So my dad was a construction entrepreneur, so he built things. And my mother brought, empathy, amounts of empathy to every conversation, given, what she probably saw every day in the ER and as a nurse. And so I'm just really grateful to have picked up a little bit from my mom. And especially when you're, at the bedside of my brother at the time, you just learn that there's so many people going through their own healthcare issues. And that really taught me empathy, because being on the builder side and being in fintech, there's probably very little empathy in that space. It's all about maximizing dollars. And I kind of got trapped into that. And I liked it, so I chose it. But coming into health tech, it's been great to kind of lean into both sides, the human side of things and this tech innovation disruption kind of mindset that we can reach more patients, we can make it more affordable. There's almost like a capitalism 2.0 when it comes to health tech, like do good and then, people can make money. And I like that order, which is very unique for health tech and healthcare in general.
Yeah. Before we started recording, you were talking about your number one founder takeaway, and it was really about this idea of manifesting. Could you repeat that?
Oh, yeah. It's like whatever you believe is true. So not only through my own journey, but in talking to so many different founders here in Austin or wherever I've run into people, it's like, oh, I'm afraid to get started. And so guess what? That fear is going to stop them. They're afraid of it. They'll just live in that fear and they'll never take that next step. So what if you could just flip that script around for yourself and say, I'm excited to get started. And then that excitement will manifest the very thing you believe, right? Or it's like, I don't think I'm going to raise any money. Well, guess what? You don't raise any money for your startup. But if you're like, I am massively convicted that I'm going to get a pilot customer that's going to help me get that capital, those people get those pilot customers and then they get that capital, right? So that founder drive and motivation and manifestation is very real. And I think that's available to everybody. When you really find your purpose and your why, it makes it so easy to operate and vision and manifest things for yourself.
Yeah. So it's one thing to just get started. It's another thing to really have belief in yourself and conviction and passion, and to get the right people around the table to help get you there.
Yeah.
You have often said, and you're not alone in saying this, that it's really not healthcare, it's sick care. And I think if you looked at my LinkedIn, it says my name and then it says health plus care, because I care a lot about health and I'm very passionate about that. I also care a lot about care, but it's different than putting the words together. So can you unpack that a little bit for someone that's never heard it framed that way?
Oh, wow. Yeah. Your LinkedIn is amazing because you're actually you're playing in both sides of that through what you do. Yeah, healthcare is actually the system of care delivery. It's a new made up word, but everybody thinks it implies health or it implies care, but it's actually a business model, surprisingly enough. And so, so sick care is this idea that we wait until somebody has some identifiable symptom, visible symptom, or some blood test that says, okay, you are now confirmed sick. Let's apply treatment to that, whatever treatment might look like. And so imagine a world where you split those words up and you say, we are going to strive to be healthy. In fact, what if you were never a patient, right? Like so many companies in healthcare always assume a patient. But my question would be like, well, what if they never become a patient? That means they have health.
What a world.
Right? So what if that was true for the majority of people? And then care would be applied to those that need it who aren't in a space of health. And that to me would be a world where almost everybody then has, and this sounds crazy to say, but a rare disease, because their permutation of that illness is going to be uniquely their own, right? Like not everybody has the same heart disease, that we claim 83 million Americans have right now. There's a blend of elevated cholesterol with this amount of inflammation, with this genetic marker, with these cytokines. And so if 80% of those people were now healthy, you could actually treat each of those individuals in a personalized way. And so that would stop being sick care. That would actually just be care and returning back to health, right? So that's how I see the world. And that's where personalized medicine is a really big deal. We're going to personalize everyone's care as though they had a rare disease. And I don't say that to any insult to somebody with a rare disease who's not getting good care today or being avoided by the traditional systems. But I think when we start to treat everybody uniquely, it's actually going to help all people with even rare diseases today get better. So
yeah, and you even experienced that in your founder journey and the different companies that you've worked with, advised, and helped co-found. How has that shown up? Can you give a few specific examples, like in the case of ALS or lupus, as we were discussing earlier?
Yeah, so it's wild to me that we have so many amazing scientists out there and they're working on kind of their narrow sliver of something that they're passionate about. And like translation is so poor. Nothing translates out to patients, right? So things get stuck in preclinical. And so when I helped co-found Coya, for example, it was looking at ALS and identifying it earlier. And most people in the space of ALS would have to almost wait till they had debilitating symptoms to then be put on some type of protocol that might extend their life 3 months. But basically ALS was you now have X months to live diagnosis. So I think in that space, for example, we were able to help take out this protocol and get it out to patients. And now it's in FDA trials. And the idea would be you catch
exciting.
that sooner and potentially stop progression. So people with ALS now and the genetic markers could live significantly longer and happier lives. And then one day they might even have a cure for it, right? Yeah, and that exists. Even the autoimmune conditions like lupus, it's like, or RA, every autoimmune specialist I spoke to when I was with Imaware was, hey, we diagnose a visible symptom. So RA meant joint damage, like loss of finger function or spinal damage or their neck, like it was bothersome to hear that, hey, that's the standard of care and we don't early screen for that. Yet those biomarkers are elevating inside RA patients, are present in lupus patients. IBS and IBD are measurable. Celiac disease has markers, and we just wait until people are incredibly ill or hurt before we, diagnose them for something.
That's something that's always bothered me too. In fact, our Our first company was called Upstream initially in the early days of writing on the back of a napkin. It's the public health premise of you have somebody jumping into the river, you want to catch them before they jump in and not wait until they've fallen down the waterfall and have all the massive trauma. That's where the healthcare system usually comes into play. It's very reactive. And I love that you've been really on the cutting edge of making a difference in that.
It's such a big system. And I know everybody in health and care and healthcare want, like there's an intrinsic desire to help people not get in the river, to your analogy.
Yeah.
But it's just like, it's like through the fault of nobody, many people end up in the river, right? And we're ingrained to just believe that's the right way to do it. And I think the idea is like, let's all come together. There's this like village mindset we have to adopt, that what if people didn't have to fall in the river? And it's not just the job of a startup founder or one doctor. It's, we should all start to rally around supporting that vision as a nation, right? Starting with making Austin the healthiest city in the nation.
I love that.
Right. So we've got to start somewhere, right?
Yeah. Start here. So Imaware, I love just even saying the name because you have your mission across. Imaware. It's this early detection, everything that you're really pushing forward. You were able to have the first home test where you just take a very small volume of blood from a finger prick, mail it, and then get results within days. And I'm curious, in business speak, who are your ICPs, your ideal customer profile? Were they the early adopters that were heavily resourced and were first in line at the Apple store when an iPhone came out? Or was it those that maybe had a similar experience to your brother, where they were misdiagnosed or discounted and they have symptoms that are unknown and they want answers? Or was it those that have problems with their pay or their insurance, where they have such a high deductible plan that they'd rather go around waiting weeks, months to get in with their provider, have a very abbreviated appointment, maybe have labs ordered or maybe not, have to go to the lab, pays for all of that, have multiple delays along the process. So I guess who was your targeted customer initially and how did you reach them?
Yeah, wow, taking me back. So early 2017, when we were actually seeing Theranos implode, was when our MVP was working for PSA testing, so prostate cancer screening. And kind of that coupled with my brother's experience around cancer, we actually did not launch with the PSA test because cancer was, even if it's a 17% false negative, we just don't want to have people get cancer, right? So we kind of actually trashed our first test, set it aside, but the science was working well. So the correlations between, the small volume blood and the traditional draw was very, very good. So the technology was there, but that initial ICP was definitely not the one we wanted to launch with. Kind of like, I'm just hearing my mom's voice, and the do no harm was running through my mind around the sensitivity and specificity of that test. Like any good startup founder should, go back out and understand, early detection opportunities, and autoimmune diseases popped up no matter who I spoke to, specifically those who had family history, right? So right away it was celiac disease, rheumatoid arthritis, lupus, IBD. People were like, hey, my mom or dad had this and it's been in our family and I suffer with symptoms and I can't seem to get diagnosed or anything until I really present. One of our first customers was a mother who bought an RA test for her daughter who had turned 21. And she was convinced that her daughter was very, very early days because she complained about a morning stiffness in her neck. And yes, morning stiffness in joints like that is a classic early stage RA symptom that I learned. So I actually gave her the test for free. I said, test your daughter. She came back positive on those biomarkers for rheumatoid factors. And she took that report and like stormed her doctor's office and said, I told you. So instead of waiting for her to get, debilitated on this as a 20-something-year-old and get on a mirror for life, they were able to put a much milder, kind of treatment plan together. She wrote me a handwritten letter and thanked me. And then I realized that our ICP are family members who are passionate about, their offspring and their children or their nieces or their sisters. Really went hard at the autoimmune disease community. Right away, I went out to like all of the nonprofit foundations beyond celiac, rheumatoid arthritis, the Rheumatoid Foundation. So they all became partners of ours for early detection, education around these biomarkers, what you can do with this report, when you talk to your doctor. That was just like, seems like forever ago, but those communities are very passionate about educating and early detection. So once we gave them their tool, they ran with it.
It's really neat.
Yeah.
And you've had so many accomplishments with that. You were the first celiac test, the first RA test. Y'all were one of the first at-home tests to have a peer-reviewed journal publication. And then also, I'm trying to think back, what was the other thing? So many accomplishments. Oh, I know what it is. It was the anti-Theranos, the really being adamant about trust and transparency in everything that you do, and really being thoughtful about having CLIA certification and meeting the criteria that's science-backed. All of this took really diligent decision-making on your part as the CEO at the time and the founder. Looking back, how do you feel about how it all panned out?
I was inspired. Cracks me up, but I was inspired by 8 Mile, the movie.
With Eminem?
Yeah, totally. So, he's getting called out for being who he is and, his relationship with life. And at the end of the last rap battle, he comes out and owns the narrative, right? He's like, yes, I am this. Yes, I am this. And it left that other, person in the rap battle just like dumbfounded, had no response. And so that was my life with investors and early partners and early scientific advisors. Was we were getting attacked on like, you don't have an answer for Theranos. You're like, why are you this? And so the narrative was always putting me on a defensive. So one day I just decided to flip my investment pitch deck from the last slide saying how we're not like Theranos to make the first slide. That's all I did. I was like, I'm going to channel my inner Eminem here, and I'm going to come out the gate and right off the bat, in the next meetings, it would be, we are not Theranos because of A, B, C, D, F, G, which meant CLIA labs, which meant we were publishing into peer review. We had independent scientific advisors who looked at the data. We published our sensitivity and specificity on every patient report. Nobody in the lab space had ever done that. So you could see that, hey, here's your outcomes and these are your data points. And here's the ROC analysis for sensitivity and specificity. And here's all the publications that validate that. Like now a patient had that information in their hand and the doctor reading the report.
It's
So we
really
just did like
powerful.
really
Yeah.
kind of what people thought were crazy things, but it was us owning the narrative around our conviction and belief in the business also, but the science behind that business. Because we had heard lots of patients say, hey, when I do an Everlywell test or someone else's test, doctors would throw those away and they would throw our tests away because it's not, gold standard. So we made sure to make it gold standard, right? And all of a sudden it became adopted. So that was really cool.
Yeah,
But it all started with like just standing with conviction and owning that narrative, right? Which every founder should do. If you have belief in your business, then own your narrative, right? Own your voice.
It's really cool to look in the rearview mirror and see how each one of those little decision points had such a huge, profound impact on the overall business projection and model. I mean, even simple things like when you joined the scientific team, you decided you were going to do D2C instead of B2B. You had to overcome some of the regulatory state rules, like having a prescription for some of these tests. So many considerations there. But my question really is for anyone that's thinking about getting one of these tests done, whether it's through Imaware or others, how do you evaluate whether it's worth your energy, time, resources? So some people will break it down into categories of, is it diagnostic? Is it screening? Is it wellness? And then they look at other measures like quality. What's the robustness of the science that they're using? So what's the quick and dirty on a consumer who's evaluating these different options available to them?
Yeah, I think we have really, there's now dozens of options for tests. You can go to labs, you can use somebody else's service on behalf of another lab. You can have the, phlebotomist come to your home. You can self-draw, you can use different mediums, stool, saliva, blood.
Yeah.
So there's definitely an abundance of choice. The intention here has to be like, you're right. Are you screening or diagnosing? So screening is kind of like you're a mime in a box. You kind of want to feel your way around your own body and its health. So I love these companies that offer, 100, 120 biomarkers, like the Function Healths and others, because that helps you understand you. Now, those may not be the best for diagnostics because they don't have a direct physician engaged. You don't have telemedicine consults, at the end of it. So screening, think like, hey, I got to figure myself out. And then if there's something there where you're like, wow, 6 or 10 of my heart markers all seem elevated, then it's time to zoom in and go potentially do a deep dive cardiology specialist panel. And then you would find that there's only one of those out there, right? With Boston Heart or, Cleveland Clinic's test. So I like the idea of like screen, then diagnose, because if you screen broadly and you see nothing kind of off base, then you can rely on that. And then you just screen periodically, right? But if you jump to diagnostics, sometimes you're going to chase your own tail. Like you're like, hey, I have this symptom. Let me go run this heart test. Well, it could come back negative. Or let me go run this celiac disease test and it's negative, but you still have this GI symptom, right? So those are the times where like you should probably see a doctor. And so I don't propose at all to get rid of the doctors through this, but rather if you want to go see your doctor, and maybe you're not fully understanding your own symptoms, a screening test can help you zoom in and go talk to your doctor at the same level. Like you level up with your doctor. And I think that's powerful.
Okay.
Yeah.
Given your expertise and all that you know about the inner workings of how this works and how a company has to go about making these little micro decisions, are there any red flags to look for or things that you should look for when you're evaluating different tests? Because there's so many options now. How do you decide?
If a test doesn't have a physician order attached to it, I mean, for many states, I think it's like 35 of the 50 states, they need a physician order. That means somebody has looked at the quality of the test.
Hmm.
So if it's not physician ordered, that would send a yellow flag for me. Now, not all tests need physician orders, and so some companies make the choice not to have them. But that to me is like, why not put a physician in it? For the $10 to $15 that it costs to requisition a test on a $99 test, like that is worth probably every penny, because if you are positive in that test, now there is a physician who has an obligation to connect you with next steps. Right. So I find that as like an important insurance for the patient, but also a good marker of quality, because,
Hmm.
what physician is going to say, hey, I'll stamp this test without seeing its quality. Right. So I love that there's physician orders on many of these tests. And a lot of the names I mentioned, do have physician orders, which is great. But the ones that don't, genetic tests especially, pull a hair and all of a sudden they'll tell you what food you can eat and what you shouldn't eat. Like, there are definitely good and bad genetic tests, or ones that zoom into epigenetics. Like, why is there no scientist or doctor or a requisition or an advisory board attached to that one? Or why is it such a black box to see your data? Yeah. So I think the second one would be like, what is your status on sharing your data, right? Like, that doesn't give away the secret sauce of how your test works, but you should share the efficacy of the test, the capability of the test. I think data is also very powerful out there. So yeah, doctors and data.
Yeah. I
Yeah.
think that's really helpful. When you go to see your provider, we do have to consider those things when we order tests. We are responsible ultimately for following up on the results. So I think that's a really good call out.
Yeah.
And then also thinking about data, trust and privacy, all those considerations as AI and big data is coming faster and faster. How is that going to impact these types of tests?
More than ever, I think it's going to expose the gaps of the general AI models. They'll just say general statements, and healthcare is not generalized. Like I said earlier, your heart condition and my heart condition might be radically different. So, like, we need these AI models. Like, the tech of the AI systems can be foundational tech,
Mm.
but we're going to need cardiovascular focused LLMs and GI focused LLMs. I don't think we can just see that OpenAI is going to be able to do diagnostics. And we saw even some of the bigger AI companies kind of back off their healthcare claims. So you can get insights and education on it, but they will not make diagnostic statements. A year ago, they were, right? They're like, hey, these symptoms mean this. You should go tell your doctor you have this, or you should take these things. They backed off that a bit. So it'd be really interesting to see if we see like a dedicated Claude Health that actually runs off a little more of a focused data set, like Reddit, sourced and things like that. So, so AI is going to be great though, because I do think, and you probably know this, you're overburdened with so much paperwork and, looking at data. Imagine your AI companion could actually help you do the ordering, take an assessment of all these biomarkers and all the history and the trends of these moving biomarkers and present something to you so you could actually have a much better conversation with your own patient.
Yeah.
I think AI can play a really strong support role, but I don't think AI is removing the doctor or the care provider in any of these workflows anytime soon.
Yeah, I look forward to that. I know that the capability is there, but it's been slow to be adopted
Yeah.
Across the healthcare organizations for all of those reasons you mentioned.
Yeah.
The patient consent and considerations. But yeah, it would be
There's lots of nuance, right?
There's a lot of nuance.
Yeah.
Yeah.
It's not like, oh, just install AI and, you can get rid of all your doctors tomorrow. It's like there's so many layers, right?
Yeah. So healthcare has like a major headwind beyond other industries. What was the most surprising thing going from fintech to healthcare? You went through COVID and you had to go through all these regulation issues and thinking through all the different stakeholders involved in healthcare.
Yeah.
What was the most surprising thing?
It's actually both positive and potentially not positive. Is everybody's afraid of the FDA. And I think the FDA has a role to play, and people should go, see the FDA, because if you have a hypothesis and you have good data, like, why be afraid of the FDA? I think they're open and waiting. And then simultaneously, the reason people don't is if you have a business that's running and you have checked off your state and your CLIA and your doctors and your physician involvement, and then you go to the FDA, now they're going to regulate your company. So it's actually like this double-edged sword that I find very interesting. When you think about like financial regulators, it's really cut and dry. and it's very well kind of process oriented. It's very well defined. And yet ironically in healthcare, it should be well defined, and it kind of rewards a little bit of bad actors, and it also hurts a little bit of the good actors because of enforcement discretion, because of the ones that want to do good then get regulated, and the ones that are trying to avoid regulation. I would love to see a fast track for those that want to do good, and a more diligence track for those that have things that might throw off yellow flags. So, an FDA commissioner that we both know has said it very well, that, adopting a relative risk model versus an absolute risk model might be very powerful. I'm 100% behind that, right? So could we get FDA approved vitamin D that has a minimum, vitamin D component to it, but it's like really fast to get that approval? That'd be amazing if our vitamins were actually like had a minimum standard, and
Oh, that
not
would
just
be
filled with
so
junk.
great.
And at the same
Yes.
time, cancer therapy should go through multiple trial stages and things like that. So I'd love for the FDA to look at relative risk and really start to create pathways. I think AI is going to help that a lot, right?
Are you seeing any movement in that regard?
100%. The wearable space got the biggest gift this year from the FDA on, I think it was Jan 6th. They opened up access and they talked about the idea that wearable data can now be used so long as there's physician involvement along. Just like kind of the testing that I was involved with years ago, as long as you had clinician orders and clinician oversight, you could have these testing modalities implemented. So I love that that's available for wearables, because now we're going to see so many things, like people who might be suffering from sleep apnea but have no idea. Now they can share that data with their doctor, or they have all kinds of different heart murmurs and things like that, and they just call it status quo. And what if the doctor could see that and say, wow, that's just beyond AFib, and maybe it's something we need to look at. And so I love that the wearables market has some support from the regulatory agency to get into the clinic. Because it's just like labs, the ones that are kind of, don't have really good quality signals. And I think it's going to really show who's got quality and who doesn't.
So fascinating. Well, you wear many hats in your life, and one of them is being an investor. So as an investor, when you're talking with potential companies that you'd like to support, what is your thesis that you want to get behind?
Yeah, I love operating in this earliest of stages. There's so many great investors in Austin, across the nation, that handle the Series A and B stuff, and that's growth and, building up your sales team and heading towards bigger markets. But there's not a lot of support for people out there who are, passionate founders who have a really amazing idea, and they're maybe 3 to 6 months into that, right? So that I love playing in that like 0 to 1 space, people call it. And there are so many amazing founders, like I said, and I heard this really amazing stat that 93% of healthcare diagnostics, therapeutics, or things that could help patients never make it to market. And the problem is that most investors say, well, that thing doesn't have a big enough addressable market, or you're too narrow focused, right? So what if we could help those companies get that product to market sooner, pilot it at places like here in Austin? We have a lot of different physicians and practice groups that want to pilot these technologies. And then what if it actually could not just help 10,000 people, but expand to becoming something that helps millions of people, right? So we'll never know until we try. So supporting those early stage founders in those areas that typically get passed over, especially if there's tech enablement, is 100% where I like to focus my support.
Yeah. I heard another successful entrepreneur describe it this way, that healthcare is like a quilt and everyone has to contribute their part, and you really do have to work together in this whole ecosystem. And so just starting,
I love that
like you said,
visualization.
is so important. I love that. You also mentioned once that you can know within a matter of minutes if you're going to invest in someone. You have a spidey sense about you, about their passion, the way they talk, about the way they problem solve, and how they speak to the problem they're solving. What is it that you look for?
It's funny. I used to go through like a checklist almost. And now I've really learned to trust my gut, because I think there's a lot to human connection that even Zoom video showed us that you can't have, that we long for this human connection. You can feel that trust and passion and resilience, even from like eye contact and a handshake. When someone speaks about their why, that pretty much tells you how they're going to behave, not just in the good times, but in the really bad times, right? If your why, like your vision for the world, is so powerful, it'll help you overcome all of the most worst circumstances, the 900 no's, the rejections. I always love that idea that founders who have a vision so powerful they can overcome anything are the ones you want to back. So you can feel that right out the gate.
Yeah.
Yeah.
You moved from Toronto to Austin. And when we were sharing our Austin stories, you have this really beautiful, positive quality about you, Jani. But you said your family's Finnish originally,
Yeah.
right? and that the sauna is a big part of life. In Austin, we have such hot days, and most people complain about this, but you love it. You love that there's this opportunity to be outside and sweat and kind of have that experience, and it brings you back to your roots. There's so much more, though, to Austin that you're really excited about. Austin is weird inherently. We're a college town. We have barbecue and tacos, and we got F1 now, pro soccer team. We have legacy companies like Dell, and then a lot of startup companies coming online too. What is it that makes Austin so great for the founder community?
Well, all those things that you can have breakfast, lunch, and dinner tacos crack me up, So you can have taco as like your entire meal for the entire day. But, I think it's the energy of people here. There's a real like mindset to come here and experiment. In fact, I think the whole city is like a human petri dish, right? You see robo taxis. People will just gladly jump in a self-driving car and, just not even worry about it. Like there are very few cities that, companies will come and test initial product at. You saw that humanoid robot walking on South Congress got smoked by a car, and that made that meme video on TikTok. There's just like a desire to test here, and people don't get weirded out that there's a robot or a taxi or a pizza delivery robot just driving down the sidewalk. So I do think that the Keep Austin Weird works so well for founders because they can trial and test and learn and do so in a place that is supportive of that, but also so many founders I meet here want to be part of this community. So it's like a give what you came here to get kind of mindset. So I love that giver mindset that everyone seems to have here versus a taker mindset, which is like, I'm going to come here and take what I need to win. I'm going to give myself, I'm going to create community, I'm going to make connection. And I think that makes it super founder friendly.
I love that you see that in Austin. And I think that part of that is because that's very much how I at least perceive you to be. You're very generous in your time and in trying to connect people. And how do you keep that positive mindset?
I just go back to give what you came here to get. When the most selfish thing you can do is to give yourself away. It's like a weird dichotomy in a way, so there's so many different analogies on it. But if you want to get into the health tech scene, then go be part of it, right? Give your time, get to meet people. How can you support people versus going in it with a mindset of let me take from it. But when you come to give, it's so unexpected, I think, these days that people really embrace it, right? So I wasn't the first to coin any of those phrases, but I certainly learned very quickly when I moved here that people here are here to give. And it's just something that feels innately natural. And I think we all deeply want to give. We're just kind of jaded in a way that like we have to take to win. And I'm just wondering if like, what if one of us decided, I'm going to give an hour of my time to whatever I'm up to somebody who could benefit from it? I'll bet you everyone could get that way back in spades. We just don't have a formula on it yet, right? So it's like almost trust it, and I swear it'll happen. Like you'll give yourself, a coffee or help somebody, and all of a sudden they'll tell you that they know somebody, just like you introduced me to somebody very powerful and supportive, and all of a sudden now I've met, entirely different groups of people I never had access to. So I really just stand by that belief, but I think we should just do more of it as a city and then as a nation, right? I think we would see insane returns on investment for that time.
Yeah, we need more of that. I'm going to amplify that clip right there.
Awesome.
You just wrote a report. Can you tell us a little bit about it?
Yeah, so there's another gentleman in town here, Jason Sharp, who's a super passionate Austinite, big cheerleader of the city and what's going on. Several years ago started the Austin Bio and Health Report, and then I joined on that last year. And what we've just seen is that this city has gone from being kind of a quiet place, number 15 in startup dollars and kind of as this really, really small ecosystem over the last decade to being almost the top 5 in the nation and really one of the top 2 when it comes to this bio and health, like the convergence of tech-enabled healthcare, right? So this latest report just shows that amazing people are moving here, companies are launching here, capital is made available here more than ever before to support these founders, to build this ecosystem. It really feels like this is Austin's moment for the next decade to be a health tech or bio health or digital health capital between the coasts, right? So you got the Bay Area, great in tech, the East Coast, great in traditional care. But smash that together, the convergence of things, the platforms, the AI capabilities. I feel all like 8 out of 10 of those next successful startups will start here.
Sounds like it's safe to say you're not moving anytime soon.
Yeah, so far so good.
Well, awesome.
I think it's worth noting on the backs of the Bio and Health Report, there's a very exciting slide. It speaks to companies at different stages. And so, yes, we have some of these legacy enterprise companies like Thermo Fisher and the big established players. And then we have some unicorns, a dozen of those companies that have valuation over $1 billion. But what I'm really excited by is this little bubble on the left that says over 665 startups that have a valuation under $100 million. So they get discounted by the traditional VC ecosystem who are looking for, kind of that marker and bigger to invest Series A and B in. So 665 companies in town focused on some aspect of health or care or prevention. Um, that's mind blowing to
That's
me.
pretty
That
profound.
means
Yeah.
we have an insane ecosystem out there, probably really fragmented. Most of those founders probably don't know other founders who have been successful or who are investing. And so I think that's the opportunity of the city, is to really create an ecosystem community around the earliest of stage companies here. I think Capital Factory is doing a great job being the first step you take when you want to get, a company off the ground. But what happens after that when you grow out of Capital Factory a bit? How many of those companies are looking for that next level of support as they head towards Series A? I think there's a lot of opportunity to really accelerate those companies, get them on the national stage, and get those founder stories out there. So
Yeah, I love that. What are you most excited about? What are you looking to watch for the next 5-10 years?
here's another stat that just is so interesting, that a majority of people who have some type of critical care actually leave Austin and they go to Houston, and Austin suffers from the ability to deliver care to those people. And it's not a lack of resources. It's just been maybe a lack of focus. So I love that UT Medicine, the new hospital being built, is going to attract an entire set of secondary industries here, from educating new healthcare professionals to the startups that want to deploy into a very leading edge hospital, to the idea that what if we didn't call consumers of this new system patients, but they're consumers, but they're getting services from a healthcare delivery company like UT Medicine. So I love that not everyone has to be a patient to get good quality care. So that makes me really excited about what care is going to look like in the nation. And I think Austin's going to be first in that race. So that makes me really excited for not just startups, but the general health of this city. And then that being a model for the nation, for the world, right? That classic UT line rings in my head, right? What starts here changes the world. It's like there is no better example of that statement than what I think is happening in healthcare here.
Yeah, I think you're an honorary Longhorn.
I got to be one day, right? I'm going to have to go do a class.
I've paid
right?
enough tuition dollars. I'll give you that
There we
honorary.
go. That's amazing.
Yeah, I wanted to circle back to where we started with your brother's story and your mom, who had this sense that something was wrong. She was like, this is not musculoskeletal back pain. Something is going on. And had she not been there, what would have happened? We don't know, but thank God she was. And so often that happens where you really rely on having someone, a family, a friend, someone that's in the healthcare system to help advocate for you. And it just speaks to how you and I are very privileged in our access to what our education and what we know. And it's played out multiple times in my own life. I mean, for example, just last week, my daughter saw a provider and was discounted as a viral illness and was told to just wait. And had we waited even a few hours, we would have had to go to the ER. And I knew that it was lymphadenitis and she needed antibiotics, and I took action and I got what she needed. We were able to avoid that ER trip. But had I not had my training and known, that would have been a very different outcome. That could have been really scary.
Yeah.
So that's part of kind of how this started, right? And that's one of the things that you're really wanting to do. And it's to really help empower people with the knowledge to make educated, informed decisions in their healthcare. So what do we need to think about in regards to that?
I do not have all the answers to that. This is going to be a lifelong journey for me. I do know that. We know a lot about sports. You can talk to somebody on the side of the road and they'll know something about sports. They'll know something about cars. They'll know something about their cell phone and the apps they use, and then simultaneously know very little about their own health. So I think that when you talk about AI, and I think the idea of like a tool that could truly be a companion, I think the spreading of consistent education of information that's delivered at the right time, that's going to become a norm, where when you imagine walking down the street 10 years from now and you shake someone's hand, they're like, yes, I'm early stage lupus. I have elevated cytokines that prohibit me from doing this. And I'm actively addressing my neuroinflammation. Like, imagine people could just speak as though that's normal tongue, like the way they speak about their favorite meals, right? So just when I think about what has to happen, it's going to start with the spreading of health information to the masses, to everybody, and at either a super low cost or no cost. Like, we just have to have that innate knowledge spread out through the entire world. Just like when we see, a Ford logo, we know it's a Ford and it runs on gas. Like, how do we know these things innately? I think health information just has to become that innate from almost birth, right? So imagine like you are born, you do have a low cost genetic test and a low cost microbiome test right from birth, and you just know yourself, like your blood type. These are coming, right? So I'm very excited by that. And then when you have that level of health data equality and equity across the world, then it's like my dream comes true. We will stop all preventable chronic diseases. So I think it all starts with awesome education and data. We just got to get it like out there.
I love that. I think you and I share in that vision too. I mean, it's even a huge part of why I'm doing this podcast, is to help get these stories, get that knowledge out there. You are also a biohacker and you're a founder, which, I mean, admittedly is one of the most stressful jobs out there. What are you doing? What do we need to know about?
So I've learned that, I do think there's a big difference between stress and anxiety. I find stress to be one that I'm self-inducing, and anxiety is something I can't control. And when I learn to separate out those two, I can very actively resolve my own stress down to zero. And that is very simply through, breath work, great sleep, exercise. Like those are all free. So stress is a free service you can provide yourself. Anti-stress. I mean, you can do this for free. Wim Hof breathing to HIIT to going out for walks after dinner. All of those things, you can take your stress down to zero. So nobody should have stress. And then when you focus on anxiety and it's the things I can't control, you can just ask yourself, a very simple question. Okay, what happens if that is true? And the moment you think about it for a second, you realize it's actually not an anxiety anymore. It's a stress, because you can do something about it. And if you can do something about it, you can bring it down to zero. So that little kind of like knowledge where everybody buckets today's stress, whether they're in control of it or not, and they say I'm stressed, they let that stress ruin their sleep, and then that impacts their quality of life, and then they don't exercise. I'm saying the opposite's true. Everything is a stress you can manage, which then lets you sleep well. And then you can tackle the world with that. So I think my 2 cents on that would be like, let's help everybody who's stressed actually get down to zero on that. And every one of those de-stressors is free out there.
Mm-hmm. Okay. I always like to close with what brings you joy in your day-to-day life? And then what legacy do you want to leave behind?
I definitely think it's family, both my parents, just thinking again, like you said, I'm very lucky and humbled to have the parents I have. And then for me to be a parent, right? Like I think of my kids, and yes, they drive me nuts, and they never clean up after themselves, and they make a mess, and they're always fighting. And
do they ignore you too? Because that's a big one for.
Oh yeah, totally, right. And yet simultaneously, the biggest source of joy, motivation, just want to leave this place better than I found it at that scale for them, because you just very quickly realize when they ask you like, hey, are you going to live forever? Like you have to tell your kids like, no, you're going to outlive me. Like that was a big moment. And that became a very powerful, like, why and just a source of energy, positivity, and joy.
I love that.
Yeah. I would just add that you should talk about yourself more and what you're up to. When you introduce yourself, you're a powerful figure in this city, in this community, you're a hyper-educated individual. And let's make sure while you're also telling our stories that you also tell your story out there as well. So you should definitely add at the intro of every one of your podcasts, your why, lean into that hard. Yeah, you have more power than you know.
Thank you. Appreciate it. And thank you for being here.
Of course, my pleasure. And thanks to the Red Fridge.
Yeah, thanks to the Red Fridge. That was Jani, who built something that moved the standard of care forward and now spends his time backing the next wave of founders trying to do the same right here in Austin, Texas. His conviction that health literacy should be as natural as knowing what kind of car you drive is one I share. One more thing. I'm working on a book, and if you're interested in any future book sneak peeks or updates, head on over to offthecharts.health and drop your email. Thanks for listening. If this resonated, please leave a 5-star rating or share it with someone who might benefit. Until next time, take good care.